I hope we are good strength and we can start now. So shall we start, Maryada?
Yes, ma'am, definitely.
Okay. Thank you. So today's agenda is that we are going to speak about the smart way to crack exam. Okay. And then later we will try to discuss, the talk article always. Hi, Ahmad. How are you? Good to have you. Okay, hi. That's great. That's great. Okay, so we are just going to talk about, and this is not going to be a formal, the session. We are going to try to involve all of you as well, because it can be a, the chit chat too. So you guys can, the talk your heart aloud. If you have any kind of concern, if you have any kind of query in terms of that, how you are going to utilize these, the 2.5 months in a smart way to crack this exam. Okay, so nonetheless, the syllabus is a kind of the never ending, but of course we need to narrow down our the important stuff, how we are going to cover and how we are going to do the important things first, and then we are going to revise what we have to do. So today, in today's session, we are going to have me. I am Dr. Zaib Qureshi, and with me my very dear Dr. Maryada Malla. We both are MRCOG, okay, and we both are the welcoming you on behalf of MedExam Expert in today's session, in which we are going to talk about something that the or maybe I hope that we may be able to give some kind of tips and tricks to pass exam in smart way. Okay, so let's get started, guys. So this is a prestigious, the Royal College building, and this has been, the dream, for every MRCOG candidate to land in there, to go there, to attend, the ceremony, or if anyone who is residing in UK, Ireland. So the people used to, the go to this building, and I'm sure you must have seen, so many the selfies, so many pictures at this gate. This used to be the old place, but in 2021 Royal College has been shifted to this place. Okay, so nonetheless, this is also a very beautiful building, and of course, and this should be all the time in your mind that okay, one day the after passing part 2, because part 2 is bridge to become MRCOG. Part 1 is basics, part 2 is bridge, and part 3 is the final exit exam. Yeah, so all you have to do is that you have to I'm sure the path is kind of difficult, okay, but it's not impossible. When I can do it, when Maryada can do it, when many candidates like us can do it, surely you can do it as well. Okay, so I'm sure one day everybody will be there, and one day you guys will be remembering us as your teacher, and we will be happy to be the part of your success stories, this way or that way. All right, so first of all, before starting this session, I just want to give you guys the tip. All the time you have to give a reminder, like we always say that we have to give soft reminder, isn't it? So soft reminder you have to give to yourself all the time that every day, today is a new day, and it brings with it a new set of opportunities for me to act on. I am attentive to the opportunities and I seize them as they arise. I have full confidence in myself and my abilities. I can do all things that I commit myself to. No obstacle is too big or too difficult for me to handle, because what lies inside me is greater than what lies ahead of me. See, I am committed to improving myself and I am getting better daily. I'm not held back by regret or mistakes from the past. I am moving forward daily. So, absolutely nothing is impossible for me. All right. So, you have to keep reminding yourself that, there is nothing what you cannot do. Okay. There is nothing what is kind of impossible. Certainly, the things are tricky, things are a bit difficult, keeping in view of the consequence, the circumstances, what we are hailing through, the things can be little bit, the difficult, but it's not impossible. Okay, so I hope with this beautiful note we can start our the today's agenda, how we are going to talk. So first of all, you need to know about the curriculum of the MRCOG, how you have to prepare for MRCOG. Then you need to know about the general strategies to prepare. And then in the later half, we are going to discuss one talk article with Dr. Maryada, and with few points about the progressive course, what we are going to start. And of course, we are going to give you the detail about it. So first, let me take you through. And I'm sure the Maryada can also pour her the experience, or whatever she wants to at any point. So sometimes the first of all we need to be well aware of the modules. Yeah. So clinical skills module is there, teaching, appraisal and assessment, information technology, clinical governance and research. And sometimes these four will come as a single module. Core surgical skills, post-operative care, they overlap, surgical procedures as well. Antenatal care, maternal medicine, they overlap too. Management of labor and delivery, yeah. Postpartum problem, gynecological problem, subfertility, sexual and reproductive health, early pregnancy care, gynecological oncology, urogynecology, and pelvic floor problems. All right. So altogether, these modules, if you just can, they narrow down all these modules, so they become like 13 or the 14. So you have to cover almost all these modules. Then yet again, you have to differentiate between the gynecology and you have to differentiate between the obstetrics, isn't it? So obstetrics you have to cover. So obstetrics part is going to be the management of labor, delivery, postpartum problem, and this antenatal care and maternal medicine. And of course, some of the operative procedures that are important in this aspect as well. If you talk about the gynecology, so in gynecology you might they come across with sexual and reproductive health, subfertility, gynecological problems, oncology, urogynecology and all. And sometimes some of the questions can be mixed. But yes, the one of the paper is going to be the obstetrics paper, the other paper is going to be the gynecology paper. So exam is all about multiple choice answers. So they can be the single best answers and extended match question. Exam is a 3 hours duration. So there is going to be, the single best answers and extended match question. The strategy, how you can solve, the single best answer, because roughly they are going to make almost 40% of the, the one paper. Okay. So roughly you can give 1.5 minutes to each, the question roughly. Extended match question, they are going to be having, the great weightage, 60%. So out of 60 to 70 minutes, whatever is left that you have to spend on extended match question. Because in extended match question, you have to give a lot of time. You have to go about, you have to read all options, and then you have to, because there are going to be, the options from A to, somewhat, there can be, the multiple options, In my exam, I still remember we had, the till option W. So for every question, you have to scan from, the A to W all the time. Then you have to narrow down your option. Okay. So that is also, the extended match question. And that is also a very tricky part. Okay. So all you need to do is that, you have to cover first major bulk. Major bulk of the curriculum is what? Green top guidelines and nice guidelines. So roughly 40 to 50% is going to be the green top guidelines. I'm sure by now you all know that how we do the download Green Top guidelines. So Green Top guidelines are directly to be downloaded from Royal College website www.rcog.org.uk. Okay, so all these are freely downloadable, freely available. So Green Top guidelines are roughly the 80 or 82, okay, in numbers. Nice guidelines, what you have to cover for your MRCOG part 2 is almost the 20 plus. So this way or that way you have to cover almost all important guidelines. If you just scan, so some of the green top guidelines are the maternal medicine, half of them, more than half of them, yeah. Thalassemia, sickle cell disease, OBS cholestasis, breast cancer and pregnancy. Okay, then we have got malaria and pregnancy, chickenpox, herpes, and so on and so. Nice guidelines, if you just talk about, so the major maternal medicine disorders are from nice guidelines. Diabetes in pregnancy, hypertension in pregnancy. Then comes the labor guidelines, intrapartum care, postpartum, preterm birth. Okay, so almost all important the guidelines are to be covered first. Okay, so always remember when you are studying, so always focus on the bulk first. Then roughly the talk article 3 to 5 years you have to do, and the topics which are not covered in these 3 to 5 years. Then comes infection guidelines, the British Association of Sexual Health guidelines. So you just have to cover important infections, okay? Like, the chlamydia trachomatis, you have to cover trichomonas, you have to cover gonorrhea, you have to cover molluscum contagiosum, you have to cover, the bacterial vaginosis, somewhat these type of infections. Not all, of course. Then this should be on your tips. Cervical, the screening guideline. Okay, this should be on your tips at all times. This is not going to leave you till you become a MRCOG as well. Then contraception guideline. Okay, faculty of sexual and reproductive health guidelines. Okay, again, this itself is a the diploma kind of thing, the alone. At this level, part 2 level, you don't have to cover all guidelines which are available on FSRH website. Rather, you have to cover the important ones. Okay, you have to cover CHC, you have to cover progesterone only, you have to cover implants, you have to cover the intrauterine contraceptive devices. Okay, so at least the basic stuff should be covered first. And if you still think that you are so the eager to the learn about so many new things, and if you think that you have time, oh yeah, then you can go through the everything. Consent advice is very much important, so you have to because this is going to be the about numbers, and numbers needs to be repeated again and again and again and again. So yes, start the doing all these consent advices from now onwards, because you don't have the enough time left. Then the MB race report. So at least last two reports you should have to do. I think we are in 2022 at the moment, so you have to cover 2021, you have to cover 2020. Okay, so at least the, and again, all are freely available on Google. Don't depend on anyone. You can even download it yourself. All you need to do is that how to use Google Chrome, how to use your search bar. Okay, because things are the quite easily available on the internet. So if something is not available, so you guys can always write down in our groups, okay, Facebook group or Telegram groups, or the whichever group you are part of. So yes, of course, we do help. All right, clear so far? Any question? Any question, guys?
Mom, can I ask you something, if you please?
Yes.
If we study the summaries of the green tube and the NICE, just you can give me a brief of as a cognitive behavioral therapy about if I study the summaries. Yeah, okay.
Okay.
Shall I pass the exam, inshallah, if I just study the summaries, or I should read everything about
See,
the
Ahmad,
green tube
I
and
won't, the discourage you on not, the studying summaries alone. But if you have a good base, okay, if you have already had, the one reading or, the two readings, not in the recent past, but, whenever you have studied, but if you have a good base, then yes, summaries are enough for you. Okay.
okay,
But
thank
for example, if it is your first time and you are aiming for this exam, then I'm afraid this is not a good the thing, because by the end what you need to do is you have to have your the concept should be clear. If you are just reading the, I'm not against the ready-made material, of course. Okay, I always encourage, if somebody doesn't have any time, so yes, can go through the guidelines and all, the summaries of the guidelines and all. But yet again, if you are not going to go through guidelines yourself, for example, if this is your first the study, so you're not going to have the good concept of in-depth study, because you have to have your concepts clear. Because summary is what summary, if I'm making summary, so maybe that point is important for me, but maybe that point is not important for you. Okay, but altogether the sometimes it's a good idea that you go through the guideline yourself. If not, then the summaries are enough. Okay, because summaries usually on med exam website we make, okay, like me, Dr. Maryada, the other mentors. So of course we do try to be very careful that we don't miss any important point. Okay. Okay, great. So Maryada, would you like to add anything if I miss something?
No, ma'am. I think Dr. Ahmad, he was asking if just reading Green Top guideline and NICE guideline would be enough. But like in past few years of questions, there are also like TOG articles. They do ask recent ones. So I think it's good if we goes like just you should have the idea of how to go through the TOG articles also. And that is very well done by our like mentors and the backend team, and also discussions that occur in the group, so that we don't miss the important points.
Exactly.
So that's the beauty of studying in med exam, that we don't tend to miss many things, because it's very curriculum is so vast that it's really overwhelming to try to catch up all alone. So if you have certain type of guidance, or if there is well directed guidance, then it's very easy for students that they don't tend to miss many of the things, and it's easy to clear the exam that way.
Exactly, exactly. And the on the other hand, in terms of that, if somebody has basic knowledge about the guidelines, or if somebody has
Yeah,
studied, so I think summaries can help well.
yeah,
So
yes,
yes, yeah,
definitely, ma'am.
summaries
But
can
once,
help well.
as you said,
Hmm.
like once if we go through the summary, like the guideline once, and then we see the summary, then we tend to remember it clearly, and it helps in the exam. The residual knowledge that we study the whole guideline once, at least once,
Hmm.
if we have gone through the important ones, we go like over and over. But like some of the talk articles, if we go just once and go through the summary, it helps a lot.
Yes, it does. It does. It does. Okay, that's very good. Okay, guys. So this is an open question to all of you now. Who is going to tell me how to successfully fail an exam? We all the time talk about success, successfully passing the exam. Is there anything which makes us to, just sway from our basic goal and, tend to distract us or something? Anyone, any idea?
Mom,
Hmm?
I think the first thing to pass the exam or any exam is the sorting of time. Our
Exactly.
problem mainly because I
Hmm.
think most of us are resident or doctors whom are working, such me.
Hmm.
So
Hmm.
we need to sort the time. I'm married and I have a baby, and I'm working more than 10 days per a month
Hmm.
continuously 24 hours. So I only have,
Hmm.
I think, 15 days per month, those for my family and for my study. The problem
Hmm.
mainly in the time. So I think we need to sort our time greatly. That's it.
Mhm. Yes, that can be one of the reason. Selection of material. Wow, very good. Selection of material. Manasvi, hi. Good to see you. If you don't stay motivated, I will see you after session. Okay? I will give you a full speech of motivation. You know me. Hi. Okay, so good to have you. Good to have you. Okay, guys. Yes, selection of material. If you don't stay motivated, anything else? Anything else? Hmm? Anything? With regard to these days, because of the technology and everything. Do you think this technology is helping us, or sometimes they distracts us as well? Because I remember when I was studying back in the 2018, we never used to have so many groups. Okay, we just used to have this the Facebook group. Hi, Ishmaila. Yes, overconfidence. Yes. So I was talking about, the groups. Groups are already there. Okay. Groups are there. And when I was studying, so maybe I am getting old, or maybe I'm from school, the old school of thoughts. But I always think that, being a part of so many groups always distract you. Okay, so what you need to do is that you have to narrow down your options. Number one, you have to narrow down that, okay, which group you have to follow, which group you think that is going to guide me in a better way, where there is the proper schedule is being running, where you think that the some of the helping hands or some helping the mentors are there. Okay, so yeah, fear, very good, Aruj, very good. Yes, Adila, exactly, ignoring the discussion, and the just the going here and there, and whatever you time you have got, whatever time you have gotten from your the busy schedule and life, and you are just wasting it. Okay, so according to me, lack of confidence. Smile, let me add, lack of confidence and overconfidence. Lack of confidence all the time, blaming yourself, no, I cannot do it. Okay, come on, this is such a competitive exam, trust me. We all are the good brains. Can you believe? We all are good brains from all around the globe. Okay, somebody is from the other corner of the world, I'm from other corner of the world. Okay, and so what we have to do is we have to compete with brains. Okay, so never say that you are not a good the candidate and you cannot study. See, we all are chosen one, we all are doctors, right? Do you think that everybody can be doctor? No, right? Do you think everybody is able to the manage how we manage? Like Ahmad has correctly said that he has the small kid as well, he's working, he's studying. Likewise, for the the working moms as well, They are working, they are studying, they are managing houses, they are managing their kids and everything. It's not easy, right? But what, we are kind of, the we I think I strongly believe in this thing, that all of us doctors are kind of warriors. Okay, so we have something, maybe, the inborn error, that, we can manage, because, we are multitaskers, we do multitasking all the time. Okay, so, if there is any working mom, so I know one, many of my friends, they get up so early in the morning. They do cook, for the breakfast. They do cook for their kids. They send their kids to, the schools. Then they go to hospitals. Then they come back. Then they do their stuff and all. Okay, and then they study as well. And we do have stories, isn't it? We do have stories. Okay, yeah, Bhavita, yes, that's, I mean, that's amazing. I seriously, I salute all of those mothers and, the parents, in fact, who are doing the same, because it ain't easy. Studying itself is, the difficult. Okay, but at the same time, never blame yourself that I'm not a good candidate for this exam, I'm not a good person, I cannot go for this exam. So you don't have to have this fear all the time, that, I cannot do it. Always remember, I can do it. There are many people like me. Maybe they are going through a lot in their, the life. Maybe, the worse than us, or maybe better than us, but still, everybody is struggling. Why we want to do MRCOG? First of all, always ask yourself. Okay, always ask yourself, what is your aim of doing MRCOG? Your aim is to be demotivated all the time, or your aim is to get the MRCOG? Isn't it? If your aim is high, trust me, you can do it. You can do it. I always, the quote example of myself, I always say that, I have failed this exam, I have passed this exam, and today I'm teaching. Okay, today I'm, the working at so many places. Today I'm, the involved at, the many international platforms. All right. So what? Failing any exam doesn't make you inferior. Failing any exam doesn't make you, the something that, you cannot do anything. All right, failing any exam doesn't, I mean, count that, you cannot do it at all, right? So lack of the confidence. So now you are not going to think about this, that I get so many messages on daily basis that, ma'am, I cannot do it, I don't have time. Oh yeah, I know nobody has time, but we have to manage time. Whatever time to get, we have to study. If our aim is to become MRCOG, so of course MRCOG is not going to be presented to us in a, the tray or a plate. Okay, we have to work hard for it. All right. If, the somebody is not motivated, if somebody cannot, the think of that, okay, I can do it, so certainly, the he or she cannot do it at all. Plus overconfidence. Okay, overconfidence, I think, is, the major thing. Oh, I know this thing, I understand, this thing. Okay, whatever Dr. Zaib has taught us, I already know. Whatever Dr. Anam or Dr. Maryada has told us, we already know. Okay, so what are they teaching us? What are they telling us? Okay, we already know this. Okay, maybe you know that, but maybe not because of, from the eye of MRCOG, maybe not from the perspective of MRCOG. If we are in this MRCOG business, so of course we know a little bit more than you. Okay, so never be overconfident. Doesn't matter if you are working as a, the consultant in your respective countries, but in MRCOG journey, you are a student. Okay, when I started off my journey for this MRCOG, I already was FCPS from Pakistan, but I had to work hard. I had to work hard. People say that, ma'am, you have so many degrees, so it must have been easy for you. Oh, come on. No, I had to work hard. I had to sacrifice so many things. I have to compromise on so many things. Okay. So if your aim is, to do something, so of course you have to do some of the compromises. You have to do certain sacrifices as well. Okay. So be ready for that. Plus, the successful failure for an exam is following too many advices. I am saying something, some XYZ is saying something, ABCD is saying something else. So what, in the end, what you will get is so many noises in your head. Okay, or maybe, everybody is saying correct, of course. Maybe, the everybody, the whoever is teaching must be guiding. But the thing is, for you have to decide that, whom I'm going to follow, and, the what advice is suitable for me according to my, the caliber, according to my time zone, according to my, the circumstances. So you have to decide it as well. Plus this thing, following too many sources of one topic, because as a doctor we all are eager to learn. Yeah, we get so tempted when we see any topic, and we get, the so I must say, the excited that okay, I have to read this from, the this source, this we all do in our the graduation phase, isn't it? The MBBS time. So this we do at that time. I still remember for myself as well, when I used to study physiology. So I used to, the big books, and to add my own points. And by the end of my, the first year, I had my own, the textbook with me. So, but in MRCOG, you can't do that, because the recommended sources are what? Royal College guideline first, then NICE guideline, then TOG articles. Okay, if the same thing is given in the RCOG, if the same thing is given in the TOG article, until and unless there is a lot of difference, which I believe is not, because MRCOG, the RCOG guidelines are recommended guidelines which are being followed, I mean, all around the globe, right? So we do have, the certain hospitals which do follow, the all these Royal College guideline, and even, at NHS they do follow their own guidelines as well. Okay, so don't follow the too many sources for one topic. First you have to cover bulk, always remember. Okay, green top guideline, nice guideline. If you think, for example, I think day before yesterday in my, the part 2 course, somebody has asked that, there is a PMS, the TOG article as well, and there is PMS, the guideline as well. So which do you think you need to read first, guideline or TOG article? Hmm? Guideline. Guideline, right? Guideline. So first you will cover guideline, and if you really think that you have time, and if you really think that, you can go through another source, then yes, open talk article. But don't just try to waste your precious time in reading, the both things. So what you will do is you will end up in getting, the frustrated, because all the time you cannot read, because you have to retain the same topic as well. You have to do certain questions, and then of course, you have to reproduce your knowledge as well. Plus, this is very much important, keeping in view of the current, the scenario. Like everybody is, the a part of so many groups. Okay, so what will happen is, by the end of the day, what will happen by the end of the day, we have got, the thousand and thousand of messages, right? So what we will be doing is that we will be just scanning messages, and at the end, this happens for me, let me tell you, because of course I'm running, the courses as well, and I'm part of free groups as well. So what I do is that, I always, the prioritize that which group I have to visit first, and then I just quickly scan. Okay, and then, where I have to show my own presence, so I do that, and then, I quickly, the pass. Okay, this is what you have to do as well. For example, you are part of, the 20 plus groups. So, the prioritize them, that okay, one or two groups are very much helpful, because they are following, the certain schedule, and they are doing healthy discussions. There is no, the extra chit chat and this and that. So yes, follow them. But, and rest of the groups, you can put them on mute. So whenever you think you have got free time, leisure time, okay, go, and then, you can do it. But for the leisure time, I must say, you have to utilize that leisure time. Okay, watch movie, listen to some songs, go into the cinema, go for a walk. Okay, spend your, the time with your friends and family, because we are not robot. At the end of the day, we do need, the some kind of entertainment as well, to ease out our neurons, isn't it? So, I mean, if you are part of so many Telegram groups, Facebook groups, plus WhatsApp group, these days, everybody is so eager to be part of WhatsApp group and all. Okay, there is no harm. But again, prioritize which group you have to follow, and don't just waste your time on reading, the thousand and thousand of messages. By the end, what you will get is, you will get, the headache, you will get eye strain, you will get, a demotivation, that okay, I'm done for the day. I'm not going to study for myself, because brain has a capacity, isn't it? So after your work, after your house chores, after your, the everything, if you have got, the 1 to 2 to 3 hours maximum in the initial phases, because with the passage of time your stamina will build, and, you can study, the even more than that. So do it. Many people, they are, the very much into that, they have to study at night time. For me, I'm a morning person. I can get up 4 o'clock in the morning, but I can't be up till 4 o'clock and then sleep, and then, the get up. Okay, because I need to sleep for at least, the straight 4 to 5 hours. at least. Okay. And during exam time, I used to do this. I used to get up early in the morning, either 4 o'clock, 5 o'clock, and then study. And I think that that's plenty of time to study. Even if I have to go to hospital at 7:30, I have to leave house. 8 o'clock, I have to be in the hospital. So after coming from hospital, so in the morning I have utilized 3 to 4 hours. After coming home, I will take a quick nap. I will do my the stuff whatever I have to do, and then I can study again. So please try to the utilize whatever time you have gotten for yourself. Okay, never think that somebody will come and somebody will is trying to, or somebody is going to the ease things out for you. You yourself can direct yourself that how you have to study, but at least 2 to 3 hours maximum, and dedicated hours, 2 to 3 dedicated hours, that in that time you are going to study according to the schedule. You are going to study whatever you have thought for yourself that I have to cover this point. Okay. So by doing all these things, the lack of confidence, overconfidence, following so many sources, following so many advices, what is the end result? A demotivated, frustrated, and a lost exam candidate, isn't it? So we think that, by the end of the day, we don't find ourselves anywhere. We are lost. Of course, we will be lost, if we will be doing that. Okay. So that was for, the how to fail an exam. So I hope, the now something is clear, and now you are also going to prioritize that how you are going to be, the utilizing whatever time you have got. Okay. Are we good to go? Everyone?
Yes, ma'am.
Okay, very good, very good. All right. Now I'll be talking about quickly that, preparation, how you are going to prepare. You have to organize yourself. You have to make folders of all modules. If you are, the desktop laptop person, okay, do that. Okay, arrange your the material on front of your screen. Okay, arrange it in folders. Okay, arrange like module wise, whatever the guidelines or talk articles, if you have to keep, okay, do them. Or if it is very much advisable for me, I bought my own printer when I was studying, and that printer is still helping me. Okay. So I used to the download guideline myself, or the talk article myself. Then I used to get it printed, and then I used to take it in my the shoulder bag all the time if I'm in hospital, because I was working as a full-time registrar when I was preparing part 2. So of course registrar duty is not the easy one. So I used to do the long shifts, everything, the cesarean, theater, labor ward, and everything. But yes, at the same time I used to keep one guideline or one talk article with me. Plus organize, organizing yourself is a very key point. You have to have a good grip in all salient points from guideline and talk. Emphasize on facts, figures, percentages. Okay, incidences, recurrences, prevalences, not the the small percentages which are given inside the some of the studies, but you have to cover them. Okay, this is a the great idea. This is where I improved and I passed my exam. I used to post the questions when I used to get up in the morning on the Facebook group, and then I used to the turn the notifications off. I used to go to work, and after coming from work I used to the scan quickly all questions, and by scanning the answer used to get imprinted in my the head. Okay, so everybody said that B, one person said C. So I used to ask that, can you please tell me that why did you answer C? Can you please tell me that why your answer is different? Maybe we can discuss, and we can get to the bottom of the correct key, isn't it? So discussion helps. So this is what I believe, that if you post and if you scan and if you answer so many questions, so trust me, this is not going to be in vain. This is going to be in your mind at all times. Discussion helps a lot. So Adila perfectly said that when you ignore discussion, so it means that you are ignoring part of your the precious the you can say the study material. Because if you are studying, if there is a the small group of the candidates who are studying, okay, and they are discussing the one topic at a particular time, like these days we do have free groups, we do have the courses as well. In free groups at every 12 p.m. GMT, we are doing the discussion according to the module. And there are plenty of the candidates who are studying. Okay. Likewise, in our, the courses which we are running, so we do have, the daily discussion, and we do post question, and candidates are, the getting benefit. At times it looks so overwhelming because of, these, the, what you can say, the curriculum, because it is so huge. But if you will, the prioritize, if you will just think of that, okay, I have to cover this first, I have to cover this first, so trust me, things are going to be easy. Many people, they make their own, the notebook like me. Okay. So I used to note down, the important points from guideline or talk article. So I still have that my notebook, and it travels with me all around the globe whenever I do. Oh yeah, I know. I know. So it's, this is all, the study pattern. I mean, many people, they are, the comfortable, or they feel, the feasible, that if they are studying on laptop, or the desktop, or the any iPad or something, so it's not a big deal. Okay, but discussion helps. So if you have done, your first reading, so I'm sure these 2.5 months is going to be enough, for you to revise, for you to go for this exam, if if you will utilize it smartly. Okay. So now I will quickly take you guys through that, what are the important books to cover for single best answers and extended match questions. So yes, we do have Andrew Sizer, we do have Rekha Butankar, we do have Justin Kune book, Brian Magwan, Amanda Jones mastering book, Seema Sharma, Janish Gupta succeeding. Then Tahir Mahmood, the EMQ part, Andrew Sizer EMQ part, P Sinha, Rekha Butankal, EMQ part, Justin Kune, EMQ part, Clivani, EMQ part, Andrea Pilkington, although it's a very old book, but there are some, the good quality questions. Keys can be different, but questions, you can utilize. Succeeding book, the Shrimishta, you can do that as well, but be extremely careful with the keys. Okay, so these are, the list of the books which can be followed, and these are the cover pages of all these books to be followed. Now I will tell you, because yesterday somebody texted me that, ma'am, can you please just list down that what are the important 5 to 6 books to cover first in the last, the 2.5 months. So it really gave me an idea that, I can, shortlist, all these books. So online sources, I always wholeheartedly recommend strategy e-learning. By the strategy, I think there are, the some 91 or some modules. Okay. Be a MRCOG associate, so it is going to be, the cheap for you. It is, the I think one registration is, the valid for 1 year. So I think you can buy it, and it always helps. Some people, they want to go for pass MRCOG, so yeah, you can take it as well. It is also recommended, but I think if you will, the cover all these questions books thoroughly, if you will discuss, if you will think deeply about, the every question about every, the option and everything, I think you can, have good, the knowledge. Okay, now this is the, the exciting point. Then in the last 2 months before exam, how you are going to utilize this time. Okay, so let me just tell you that now in the last 2.5 months, you have to prioritize your stuff. You have to make a list of important must to do topics, all important guidelines, talk articles. You have to have a daily and consistent study or revision. Now there is no excuse that I cannot do it. I don't want to do it. Oh, come on. You have already wasted a lot of time. Now there is no time. If you are really aiming for January, so I think this is the golden, the, and in fact ample amount of time. You can cover everything. Okay, you have to divide time in 24 hours. Whatever time you have gotten, you have to revise, and you have to do question practice as well. You have to pick important modules first by weightage of papers like ops and gynae. For example, labor part, maternal medicine part. Okay, green top guidelines, they are very much important. So you have to pick all these important module first. Okay, so this is a kind of, the turning point. Algorithms. Algorithms which are present in the back of, the some of the green top guideline, some of talk articles as well. So like I said that, if you guys are, the paper person, so you can get it printed yourself. Okay, and if you are, the laptop desktop person, so you can take a screenshot, and you can make a separate folder of your algorithms. You have to revise all those algorithms on daily basis for at least, take out this dedicated 30 to 45 minutes time. I still remember for myself, I had, all these papers pasted in my, the study room, almost, the doors, the windows, the walls. And after, my exam, I had to repaint my, the room because of, all these papers. Because I have a habit that, if I'm studying, so I'm studying, but, if I'm walking, if I'm, the working, this and that. So, I mean, it really gives me, the good, the idea that if I'm revising. Okay, so you guys can, I mean, bring as many ideas as you want to. Okay, color them, color your books, color your paper. So mind has a capacity that, the mind will focus all these things, and you can, I think you can easily remember stuff. So when I was in exam hall, so I used to say, okay, yeah, 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 I have revised it, day before yesterday. It was on, the okay. Now I remember. By the end of my preparation, I was, alhamdulillah, able to, tell that, okay, this part is written in this side of the guideline, and this, the paragraph in the bottom or in the, the upper paragraph. Okay. So, trust me, this is not like, I mean, impossible. All you have to do is that how you are going to prioritize your stuff. You have to prioritize practice books as well. And you do try to do all available question pool, but beware of keys. Don't blindly follow keys. Don't blindly, the waste time on keys as well. Okay, if you think that something is wrong, okay, no problem. You do have all available sources. Open your guideline, open your talk article, correct it. Okay, discuss with your study buddy if you have any. If not, then I think group study is a blessing for anyone. There is at least, you know in the end, at least 5 to 6 dedicated hours are needed daily. Close to exam, you have to take 10 to 15 days off at least. This is a must, because if you will not revise whatever you have studied so far, it is not going to, the help you in real exam. Again, I don't want to sound repetitive, but let me tell you that mind has a capacity. Okay, mind, the scan and, rescan all these things again and again, and you can have, the easily all these things can be easily, the recalled in the exam hall. Okay, if you have revised, lately, so you can, quickly do these things. Then priority books to be done. I wholeheartedly recommend Single Best Answers and EMQs, this Tahir Mahmood book. This is my all-time favorite, but this is a pretty old edition, so be extremely careful with the keys. Justin Kune books, relatively new, but still it has, the some keys from the old guidelines, so be careful. And it has very standardized question, close to the exam. This Brian Magwan, almost, the 100 questions, so doable. Amanda
Yeah, no.
Jones, 300 question, doable. Okay, do them. Andrew Sizer, this is very, the book, beautiful book. Okay, so this is also very book, do them. EMQs from P. Sinha, it has got two, the volumes, gynecology and obstetrics. So you can, do all these EMQs from P. Sinha book as well, and plus strategy e-learning. So in the last, the 2.5 or the 3 months, because exam is going to be on 19th January, I believe. So 19 days and 19 days this and 2 months. At least you have, the complete 3 months if you just, go through like this. So I think you can easily cover. You can easily cover. It's not impossible at all. So do you guys think that you guys can rearrange your stuff and, you can do it yourself? Hmm? No, Shagufta, no, old Andrew Sizer is old, okay? This one is new edition. You have to buy this one, all right? This is the new edition. That is an old edition, and it has, that edition was only single best answer, if I'm not wrong, okay? And this edition, it has single best answers and EMQs as well, all right? Okay, okay, good. So do you guys think that, now you can prioritize your stuff? And if you take, the advices, do you think that now you can rearrange your stuff again? Because you still have got 3 months, isn't it? Okay, very good, Manasvi. This is what I want from you at least. Okay, very good, very good. Okay, all right. Maryada, I'm sorry I've been talking and talking. Would you
No,
like to
no,
add
ma'am. It's
something
okay.
in?
Exactly, ma'am. And like as the other day we were talking, like what we can do for the students who are appearing for a January exam. Actually, we had planned for the September group also, but due to our own schedule. So definitely, like these 2 months, these are more than enough. If you are more dedicated, you give like 5 to 6 hours a day or time. And even
Hmm.
if you feel like these are so many books we have to cover, so we are discussing questions like daily, whatever is posted in a schedule. So we do post the questions accordingly from that schedule, and we do like kind of cover all these books. So even if they are present in the discussions or they take part in this progressive course, so it would be easy for them. They will not be feeling that they have done 5 6 books already. So that
Exactly.
part, oh, it wouldn't be as a burden to them. So whatever the course, you can have a good look through the guidelines, and then we'll be discussing the questions that way. So in that way, you'll be doing the guidelines as well as the questions hand in hand. So that's what makes the joining this course much more easy for you all.
Exactly, exactly. So, in terms of the general strategy, you need to be positive towards what you learn and you try to absorb it with examples, references, and reasoning. Always think of the, this is my bad habit, sometimes, my friends used to get annoyed whenever we used to discuss. I used to say, okay, where is it written? Where is the reference? Okay. Where is the reference? Okay. So if you will think like this, that, okay, where is the reference? Where is it given? So I think things are going to be very easy. Okay. Shazia, no, no, no. There is no exemption. Okay. You have to start from scratch. Exemption has been ended back in 2007. Okay. You have to do it. There is no exemption now. Well, I will come to that, Ahmad. I will come to that. Okay. Okay, so like the Maryada said that we are doing the January course exam. Okay, this is going to be the e-course along with the dedicated group on each important module topic wise. So we are going to have daily discussion on dedicated group. You will get recordings of each session. There is going to be topic test of each module, green top guideline, nice summaries, talk article summaries, bash guideline summaries. Okay, FSRH contraception guideline summary, consent advices, scientific impact paper summary, mock exams, then Q banks, talks Q bank, and dedicated mentorship for course till exam. So me and Maryada, we both are going to be doing, this course. And if anybody who is interested can get in touch with me, Maryada, or our team as well. Okay. So we are going to start from November, and this is going to be till your exam date. Okay. So I hope we guys we can the guide you through and perfectly that how to use this, how to utilize this time, and how we are going to go about this. Okay. So coming to your question, Ahmad, so let me tell you the recall question. Okay. So recall questions you can do once you think that you have finished your curriculum properly. Okay, I won't suggest to do recalls in the beginning of your the preparation, because recalls are recalls, right? Recalls mean that the questions which have been recalled by candidates like you, like me. So I think it is the quite impossible for somebody to remember 200 questions with the correct stems, and then the coming from the exam and writing all these out. Okay, recalls gives us idea that okay, which topic is going to be important and which is going to come. Nonetheless, the important topics definitely are going to repeat, which gives us false feeling that okay, these questions were from recalls. But I believe, the college is not stupid. Even if they have to, the repeat, some of the question, some of the topics are going to be there, like labor part, like urogynecology, oncology. So the things are going to be there. Yeah. All you have to do is that at least you can scan them, but don't rectify them, don't memorize them. Okay. What candidate do is they do try to memorize things that I really don't like. Okay. I really wish, that everybody has, the good concept. They really work on, the concept. I tell all of my students to work on concepts as well. My the beloved students are here and they know me. That how I tell them that okay, your concept should be clear. What do you think of yourself? If you are asking for keys, okay, from me, First, I will ask you, okay, you tell me what is your answer. Then I will give key from my side. Okay. So always remember, learn to justify, learn to, the how you are going to keep your concepts clear. Okay. So, this is very much important. Exactly, exactly. Okay. So as a med exam expert team, we are helping you sail through this tough and long journey. Okay. So we do have different plans. So if anybody who wants our help, and nonetheless, we are working in our free groups as well. So it's not like, that we are not going to help you if you guys will ever come. Okay. So of course, we are going to do. Rahila, you can talk in, the later for this. Okay. For the recalls, basically we don't generally the do right away. Okay, but of course in the end of your preparation, we will discuss some of the important questions. Okay. And of course, even with this, the package, this biostatistics workshop will come, and the biostatistics questions, roughly, the 6 to 7 questions will come from the biostatistics as well. So these can be dealt with our expert mentor, Dr. Desiree. She always do it, very, the religiously and very in a very good way that our candidates get benefited. Okay. So with anything, you think that you need our help, if you think that we can guide you, so you are more than welcome to join us, and trust me, we will guide you with the best of my knowledge. Okay. Exactly, exactly. Yes, Rahila, don't worry. Okay. Don't worry. Is there any question, guys? Anything which I was not clear about, anything which you think it should be addressed? Hmm? So please take this, the message, and this should be the take home message, that now from today onwards, you are going to take every day as a responsibility. Okay. Every day as a new challenge, every day as a new day for yourself as well. That okay, this is my target and I have to do it. No, doesn't matter if you are doing it 50%, 60%, at least you are trying, you are doing it. Okay. And trust me, nobody is 100%. Okay. Nobody is 100%. PIL? No. PIL, patient information leaflets, are for part 3, not for part 2. Okay. PIL for part 3. Um, no. Ahmad, you have to be, the RCOG, the associate member. Okay. Then you can have, the full access of tutorials. There are, I think, 95 or 96 tutorials. Okay. Yes. You have to do, for example, asthma. Asthma is a very, the old TOG article. Thyroid disorders is an old TOG article. Okay. SLE is an old TOG article. So you have to do them. Okay. And don't miss all these important topics. And I basically am a maternal medicine lover. So I always say that, never say that, the things are going to be, the bad. Hi, Huba. I'll call you. Okay. I'll call you maybe, the later tonight or in the morning tomorrow. Okay. So do get in touch with me. All right. I know, the starting is always difficult. Okay. And of course, it feels like, like we have said earlier in the opening statement, because of the huge syllabus, it looks very overwhelming. Okay. It looks very overwhelming, that how we are going to start or restart as well. Okay. Yes, to begin is half done. Exactly. It's the courage that counts. Like I said earlier, that take every day as a challenge. Okay. Take it as a challenge for you yourself as well. That okay, this is my target for today. Okay. Why we do make schedule? Because we want to follow them. Okay. For example, if in for example we are following. Let me take an example of the free guide group, because I'm hailing me, Maryada. We both are doing that. So if today's topic is sickle cell disease, so this should be my aim, to cover sickle cell disease guideline today. Even if I cannot, the finish completely, but at least 60%, 70%. I mean, it is to be done. If tomorrow is a small topic, so I can cover rest of the topic with that topic. So never feel that if I'm not the finishing one topic today, so I'm a very the bad thing. Okay. Exactly, Shuvta. Okay, start is always difficult. Trust me. for me myself, like I said, that when I started off my MRCOG journey, so I was already, the FCPS. So it was very hard for me to go through again physiology, pathology, and the biochemistry, because of course, it's been like, I mean, years when I have studied that. But because my MRCOG was aim, so I had to do it. Okay. And once you are in this journey, trust me, never think of quitting. Quitting should never be an option, and quitting is not an option at all right. So trust me, if you will the study this MRCOG, and inshallah, even after passing this MRCOG or even before, you will feel a lot of difference in yourself. uh, Sweetheart Bhavita, even if you can cover one guideline, okay, according to the schedule, one topic according to the schedule, I'm sure you can finish your syllabus. Okay. No, one is okay. Talk articles, see, talk articles are small. I think it can be covered in hardly 30 minutes, 45 minutes. Okay. Guidelines needs time. Okay. Because talk articles are like story that you will start with incidents, you will go in the flow, and you will go, the step by step. If you have just noticed, or, notice it, from now onwards. Talk will start from introduction. Then there is going to be brief explanation. Then there is going to be, okay, what could be the investigation? What could be the management? And what is going to be the conclusion? So it is like a story. Okay. So take talks as a story as well. All right. So just stay focused. Stay focused. Stay, first of all, study your bulk. Study your bulk. The study, finish your important modules. Bulk means green top guidelines, nice guidelines. Okay. If you have finished them, the nicely, so I think you have covered half of your syllabus, and then rest of half of the syllabus. Okay. Another tip for me. I have never done biostatistics in my whole life. When I say whole life, I am 100% sure I have never done it. For part one, I have not done it. For part two, I haven't done it. For part three, even I didn't do. But still, I managed to pass. Okay. So what I do always do is I focus on bulk. If 5 or 6 questions are coming in every exam, so I am not going to jeopardize my 95 questions for those 5 questions, because I know I cannot do biostatistics. So why shall I, put my all energies into biostatistics? Rather, I will use that energy into maternal medicine, oncology, urogynecology. I will keep my concepts clear. So what I will be doing is that I will be taking marks from those modules rather than biostatistics 5 to 6 questions. So everybody, I'm sure everybody know what their, the strengths are, what their weaknesses are. So try to focus on them as well. Okay. So don't unnecessarily put your burden on that. Okay, this is study, this is study, or this I have to do. If you don't know anything about biostatistics, so don't do it. Don't unnecessarily waste your 15 days, 20 days for, the one module. Okay. Because this is a weakness for, the many candidates, I know. Because I've been teaching around the part two for like, 3 4 years now. All right. So this was from my side, guys. So I'm always available and I'm always reachable. Of yes, biostatistics. Yes, you will have biostatistics workshop, and we do have a very good mentor over there. Okay, but not me. I apologize beforehand, but I can help you in almost every curriculum there is except biostatistics, because I have never done it, and I never ever want to give any for the wrong answer, or any concept. But of course, I'm with you. And yes, Maryada knows very good biostatistics, so she can revise as well. And Desiree, yes, she's an expert. All right, so she will do that. And apart from that, of course, for all modules I'm there. And we do have a the I never touched in my life. Can you believe, even in FCPS, of course we used to have the few questions, but I never did it because I don't want to waste my time on the 5 questions. Rather than I will focus on 95 questions. If I have to pass out of 95 questions, I will definitely pass. So I did. All right. Okay, guys, thank you so much. Thank you so much for listening to me. And I hope, I have put my message across to all of you that, what you have to focus on, how you are going to utilize your time, how you are going to, the prioritize your stuff. So I hope things are going to be easy. From now onwards, take every day as a challenge, take every day as a new day, take every day as a new beginning for yourself, and never say, I cannot do it. All right. Never say I cannot do it. Always remember Dr. Zaib said when she can do it, you can also do it. Okay. So, I mean, it's not like that every, the teacher has always been a teacher. We have always been, we have been a student as well. Okay. I personally myself have been failure as well. So I'm very proud of myself that, I have come this far. So I never hesitate to admit that I have failed this exam. Okay. So what? So what? Has it, the narrowed down my options? Has it, the ever said has college, refused to give me the degree afterwards? No. After doing MRCOG, I did my Irish exam, I did my European board as well. Okay, so what? Failing one exam, doesn't mean that you are a bad candidate or you cannot pass any exam. All right. Okay, okay. Thank you so much, sweetheart. Thank you so much. So I hope you guys are going to prioritize yourself. Oh, yes, yes. Ishaq, you can contact our team. All right. So over to you, Maryada.
Thank you, ma'am. It was so nice listening to you after so long. And
Thank
the reason
you.
that I cleared MRCOG is because you were always there motivating us, each one of us.
Yes, and I'm very proud of you. You know that,
Yeah.
guys. Maryada has been my part 2 student. Maryada has been my part 3 student as well. So I am, the one of the lucky mentor, who have mentored her. So I'm extremely proud of her. Yeah. Okay.
Okay.
Okay. Over to you.
Okay, ma'am. So guys, I hope like Dr. Zaib, she has cleared everything regarding the course and how you need to prioritize things. So regarding this progressive course, it is specifically meant for those who are trying for January because we have only 2 months. So it will be a compact course where we'll be helping you out with everything possible that will help you clear this exam in a single go. So after that, I would like to start with this course on topic on talk. It is the acute and the chronic pancreatitis in pregnancy. Okay, so it was a talk article in the year 2020. So I chose this topic because I saw a few of the past questions, and there was few questions from this talk articles. We would probably not be focusing on it, but as the questions had come on this, so I wanted to share the important slides on this talk articles with you guys. So is it okay if I start? Is there anything you guys want to ask in the beginning? Okay, so I think I would like to start with it now. Okay, so as we all know, as there is pancreatitis, itis at the end, so it's the inflammation of the pancreas. So it could be acute with sudden onset or chronic, which is caused by the repeated episodes of the inflammation of pancreas that can result in the pancreatic dysfunction. Okay. I'd like to apologize because these slides are giving me some tough time changing. I hope you guys understand. So regarding the occurrence, the incidence of acute pancreatitis is rare in pregnancy. It's around 3 per 10,000 deliveries, with high rates of preterm delivery and mortality up to 3%. Whereas for chronic pancreatitis, it has an annual incidence of about 5 new cases per 100,000 population per year. So it's not a very important percentage, I would say, that you guys need to know. There are certain percentages that we have to know. Okay, so it doesn't fall under that category. And in past few years, what RCOG has done is they have cut down the number of questions of percentages. So that has made the life a little bit easy because we had to mug up so many percentages before. That is not the case now, but the must know percentages are the must know. You need to know that. So regarding the symptoms and signs of acute pancreatitis in pregnancy, so it has for the acute, definitely there's a sudden onset. Okay, there's a sudden onset of pain in the upper abdomen, usually in the epigastrium, which irradiates to the back. The lady might have anorexia, nausea, and vomiting. When we do examine the patient, there will be an epigastric tenderness, there will be reduced bowel sound, there will be fever and tachycardia. We need to note that if the patient has a low-grade fever, it is mostly because there's a systemic inflammatory response syndrome, SIRS, rather than infection. So the differential diagnosis that we have, they are hyperemesis gravidarum, okay, preeclampsia, HELP, placental abruption, as well as the non-obstetric causes such as biliary colic or gastritis. So sometimes what happens is they might give the question, okay, like in SBAs or AMQs, that regard the signs and symptoms kind of mimic the acute pancreatitis, but it might not be that. So you need to know what are the differential diagnoses. Definitely there will be certain clues, certain buzzwords that will help us to know what the diagnosis really is. So these are the differential diagnosis that we need to know. So am I clear? Is there any questions till now? Okay, so now moving to the causes of acute pancreatitis. So this is the question that has been asked pretty much of times in SBA. What is the common cause of acute pancreatitis? Okay, and the answer is gallstone. So it's over 65%, and followed by alcohol, hypertriglyceridemia, and idiopathic. So these are like less common causes that you need to know. The questions of the common cause of acute pancreatitis, gallstone, it has been asked twice, okay, in the year September 2021, as well as just the last exam. So now how do we diagnose a case of acute pancreatitis? Okay, so you need to know there are 3 criteria, out of which if there are 2 criteria fulfilled, then we diagnose it as pancreatitis. So number 1 being there's an abdominal pain, which is typically in the epigastric region that radiates to the back. Okay. Second, it's a laboratory finding. We have the serum amylase and the lipase, which is more than 3 times the upper limit of the normal. Okay, it's usually more than 300 units per liter. This value is same as for the non-pregnant patients. And third is the characteristic features of pancreatitis on the imaging. So regarding this investigation, so I kept this table, but you do not really need to go into the details. Okay, even in the talk articles, you might feel that there are so many tables around there, but it's not necessary like you need to know about each and every table. You can just give it a read once, but not necessary that all tables are important. So to know which table you have to focus and which table you don't need to like really go through. Because there are so many things that you have to cover, you feel really overwhelmed which thing you need to cover or not. So for that, it's very important you have a discussion with your friends, you have discussion with the mentors, you stay in the live sessions. Okay, these are very important. That's why. So regarding the investigations, we have the blood test that can be done on admission and at 48 hours. So usually we do the arterial blood gas. We can do the full blood counts, urea and electrolytes, liver function test, okay, bone profile, lactate dehydrogenase, C-reactive protein, glucose. Daily blood test is required only if the parameters are abnormal. Otherwise, we do not do it daily. We do it on admission and at 48 hours. So what is the imaging? So this is the another question. This is the another SBA that is usually asked. Okay. So normally we do ultrasound abdomen. That is to know the cause. Okay. Because as we know, gallstone is a very like the most important cause, commonest cause of acute pancreatitis. So we do ultrasound to look for if there's any gallstone. Okay, to do that diagnosis. Whereas CT and MRI, it's for more than having a diagnosis, it's more for if there is any complications or not. So that's why it's written like we do CT and MRI after 5 days if concerned about the complications. Okay, so this is another important question, that is when do we do CT and MRI? So there may be options like immediately, after 48 hours, 3 days, or 5 days. So answer is 5 days, because within that time span the complications might not have arisen and we might miss the diagnosis, we might miss any complications. So if we do after 5 days, then the complications can be visualized by CT and MRI. So other tests are the lipid profiles if no gallstones are seen, because we have seen that hypertriglyceridemia is also one of the causes. Okay, so is there any question, guys? Okay.
No, ma'am.
Okay, so shall I move forward? So regarding this management of acute pancreatitis in pregnancy, it's a multidisciplinary team approach. Okay, so for part 2, you might not be needing this term as much for part 3, because most of the things like the medical terms, the like the maternal medicine, most of the surgical conditions. Okay, so most of these are dealt in the multidisciplinary team approach, and the management that we give, it's largely supportive management. Okay, so the management that we do for acute pancreatitis in pregnancy is pretty much same that we do for the non-pregnant patients. So even this Atlanta criteria is not very important for you, but as it is very easy to understand, I just kept a slide so that I can just explain it and it remains in your mind and you don't have to really go through when you go to this guideline. Okay, so there are 3 types, okay, in the Atlanta criteria, how they have described the severity of acute pancreatitis: mild, moderately severe, and severe. So mild, just remember, in mild, there's no organ failure and there is no complications. Okay, like there's no local complication, no systemic complication. So it's easy with the mild. For moderately severe, there is a transient organ failure. Okay, so we have like we can see the organ failure, it starts from the moderately failure, but it is transient. That is, it lasts for less than 48 hours. And second is there is a complication. Okay, may it be local or systemic complication, but there is not no persistent organ failure. So it's moderately severe. And the third one is it's a severe pancreatitis. Okay, so severe means there is a persistent organ failure. That is, it lasts for more than 48 hours and there is single or multiple organ failure. Okay, so it's just giving you guys so that even if you get questions from this thing, you can easily answer it, because I just wanted you guys to have a clear concept on this. Okay, so we know that there's a lot of third space fluid loss in pancreatitis. So the first thing that we need to do in management is give IV fluids to the patient so that they keep up with the third space loss, and also they maintain an adequate tissue perfusion and the urinary output. So urine output, it should be 0.5 milliliter per kg per hour. Second is we give analgesia because it's a very painful condition for the patient to have pancreatitis. So many would require opioids. Otherwise, a simple paracetamol also we can start up with. Thirdly is to give the venous thromboembolism prophylaxis. So this thing you should remember when you're also doing the VT guideline, right? So the venous thromboembolism guideline 37A and 37B, when you are doing that, so you should remember if there's a question that the patient has pancreatitis, so what score it comes in. So that way, if you correlate, it's easy for you can correlate the guidelines and easy for you to answer the questions. Thirdly is the nutrition, okay? So you can give, first thing is we encourage patient to have the oral intake, okay? That is encouraged. But if they're not able to take the thing orally, then what we can have is a nasogastric tube or the nasoduodenal tube for feeding, so that they can have a total parenteral nutrition. And antibiotics we only give if there is a proven infection, because even earlier slide I have discussed that fever is not a sign of infection but of SIRS. So if there is a proven infection, then only we give antibiotics. And imaging, ultrasound to as already discussed earlier, to see if there's any gallstone or any causative thing that is causing the patient acute pancreatitis. Otherwise, if we are imaging for complications, then we do CT MRI, and that is also after 5 days if complications are suspected. Okay, am I clear on the management? So it's just simple management thing, okay? Because whatever we do in the supportive care, okay, we give fluids, we give analgesics, we see for the nutrition, then the venous thromboembolism prophylaxis. So it's like a general management thing that we are doing here. So regarding the modification of risk factors, so that there's no further episodes, okay? So this is also another important SBA. So when do we do the laparoscopic cholecystectomy is when we know the cause is because of the gallstone. We can perform laparoscopic cholecystectomy during the index admission, okay? When we're admitting the patient, or within the 2 weeks of the discharge, okay? We can do interval laparoscopic cholecystectomy as well. So it is done at 12 to 24 weeks of the gestations, or after delivery also it can be performed once the patient has subsided the acute phase. And we, if there is any need for the organ support, okay, when necessary, we can refer the patient to the critical care. So that was the management of acute pancreatitis. Now we're moving to management of the complications. So am I clear till now? Is there anything you guys want me to repeat? Okay, so now I go to the management of the complications. Okay, so they have complications. It could be local, it could be regional, or it could be systemic. For the okay, so local, if there is acute peripancreatic fluid collection, okay, so it's like basically local is as in near the pancreas. So there is acute peripancreatic fluid collection, there is pancreatic pseudocyst, there's acute necrotic collection and walled off necrosis. So it's like basically all of the pancreas. So regional is the near about the pancreas. So there's gastric outlet dysfunction because of pancreatitis, there's splenic and portal vein thrombosis and colonic necrosis. Okay, systemic means there's worsening of the known comorbidities. Okay, for example, there's ischemia of heart or lungs, so there's the lung disease. So there is the widespread implications of the acute pancreatitis. So what about pancreatitis and the pregnancy outcomes? There is increased rate of the preterm birth, that is 15 to 32%, and there is significant fetal mortality. So based on the higher premature delivery rates, we can use the steroids. Okay, so you might think that should we give steroids or not because the patient has pancreatitis, but it can be considered. We can use the steroid for fetal lung maturation. Okay, there's no as such contraindication to give steroid, as well as even we can give magnesium sulfate for neuroprotection of the premature infants. The decision to deliver, it must consider both the gestational age and the severity of pancreatitis. If we feel that the patient is deteriorating, okay, despite we are giving active treatment, like for 24 to 48 hours of active treatment in moderate to severe cases, at that time we have to decide to deliver. So, okay. So is there anything you need to ask about the acute pancreatitis? We'll be going to the chronic pancreatitis now. So as discussed about the chronic pancreatitis, it is the progressive inflammation of the pancreas that's occurring. Okay, so there is this, it causes the irreversible damage of the parenchyma that causes both endocrine as well as the exocrine dysfunction. So what happens, why it occurs, this chronic pancreatitis? It's a multifactorial cause, but the common cause is alcohol and having a recurrent episodes of the severe acute pancreatitis. Okay, so Wegman, can you mute your mic? Okay. So you should know the difference between what are the causes, what things causing the acute and the chronic pancreatitis. Okay. For acute, it was gallstone. For chronic, it is the alcohol and recurrent episodes of severe acute pancreatitis. So we have the tendency, we learn one key for one thing, like most common cause for pancreatitis is gallstone. And when the question is asked for chronic pancreatitis also, we tend to tick for the gallstone, whereas for chronic, it is the use of alcohol. Okay. So there, even the patient, they have abdominal pain, which is the most common symptom of chronic pancreatitis. Okay, so those patients, they require regular opioid analgesia. Okay, and the pain score is done from the McGill Pain Questionnaire. It's the most appropriate assessment for these patients. So what exocrine function does is, so the disease of the exocrine pancreas, it can cause them bloating, cramping with meals, abdominal pain, steatorrhea, and weight loss. Okay, so there's a test called fecal elastase. It can be used to evaluate the pancreatic secretion, but it might not detect the mild to moderate insufficiency. What alternatively we can do is a trial of pancreatic enzyme replacement can be used. That can be titrated to the clinical symptoms. So dose of pancreatic enzyme replacement, it may need to be increased in the pregnancy. And even the vitamin supplements can be considered. For this, we might involve the need of a nutritionist in the multidisciplinary approach. This endocrine, what it does is it does the endocrine insufficiency causing pancreatogenic diabetes. Okay, so there's the reduced insulin production and there's increased resistance to the insulin. And because of the combination of two, there is diabetogenic, there's a pancreatogenic diabetes. So pregnant women, if they have a history of chronic pancreatitis, so we should have an oral glucose tolerance test arranged at the booking. So for the book, so we should know that if there's a patient who has chronic pancreatitis that had come to you, so there might be a question, okay? So when do we do the oral glucose tolerance test? So we don't do at 24 to 28 weeks. We have to take the booking as the correct answers. This can be a potential question. Okay, and for the chronic pancreatitis, we need to have the early involvement of the diabetologist in the team. So how do you manage this chronic? As we know, this chronic pancreatitis, the most common cause is alcohol. So we need to tell the patient to have abstinence from alcohol and smoking, okay, because that helps them to improve from the pain. And as they are in constant pain, so there will be the regular use of opioids. Okay, so they may have a related tolerance to it. So that might affect the choice of what analgesia that we give to those patients when they are in labor. Okay, so if a mother has been on regular opioid, so what it can cause to baby? It can cause withdrawal. Okay, so we have to see the signs and symptoms of withdrawal in the baby. So these are all the potential questions that can come, okay, in the exam. So it's a short talk article. At the end, what I would like to say, it's acute pancreatitis. It's a life-threatening, though a rare condition, but it can be encountered in pregnancy. Diagnosis can be considered in any patient with acute onset of upper abdominal pain. Okay, early and continued input of an obstetrics, surgical, and critical care team is very important for both mother as well as the baby. Okay, so this is the end of this talk article, short one indeed. So is there any questions you want to ask regarding this talk article, or how you go forward in this 2 months, or how to go through talk articles, anything?
Yes, guys, any question? If you guys have any question, because lately what we have noticed that acute pancreatitis, this talk article particularly, has been, the asked in the real exams. Okay, I think it was in Maryada, if I'm not wrong, in July exam as well, and in January
Yes,
too.
ma'am. Yeah,
Hmm.
July, September also, ma'am.
July and September. Yes. Okay. So in both exams, the questions have been asked from this talk article. So remember, the basic difference. What Dr. Maryada has told you guys. Okay, that in acute pancreatitis, the most common cause is going to be the stone, and the chronic pancreatitis, the major difference is going to be the alcohol.
Alcohol.
Alcohol. Okay. Treatment is going to be in acute pancreatitis, of course, and chronic pancreatitis on the medical management, the what we do, conservative management, because of course we can't do any, the surgical management in pregnancy. So be extremely careful, okay, while you choose the questions, because there can be the narrow margins in questions. All you need to do is read question carefully, and then the try to find out that what exactly could be the buzzword. Okay. Hi, Hannah. Oh, so good to see you. So good to see you. Wow, this is amazing. Yeah. So it always gives me pleasure when I see my students. Okay, again and again. So I know, maybe not in so many ways, but of course, as a teacher, I love to see all of my students, of course, and even the all of my students passing exam as well. This really makes me the feel so proud. Okay, thanks so much, guys. If still something is not clear, if there is something you want us to repeat, so we are here. We are here to support you, guide you in terms of course. Of course, we do have a long course of January. We are starting this, the e-course, the progressive course. So me and Dr. Maryada, we both are going to be there with daily discussion, and of course, we are trying to focus on important, the stuff to pass this exam. Okay. And yes, of course, the none of the course or none of the mentor can be at your place. At the end, you have to be the little bit the good for yourself as well. Okay, you have to study hard, you have to work smart, you have to stay focused, you have to stay motivated, and that's it. That's it. That's all you need for exam. And never think that this is impossible. Okay, so it is quite doable. All right, it is quite doable. All you need is the smart study, focused study, and that's it. All right. So anyone who wants to join, the course can reach out to me, reach out to Dr. Marada or our team as well. Okay. And apart from that, we are running, the Facebook group guide, Telegram group guide. Okay. And we are, having discussions as well on daily basis. Okay. So do join course, or, the free discussion as well. So it helps. It helps this way or that way. It does help. All right. Okay, guys. Any question? Okay, so I believe nothing is, no question is there. So I think we can conclude our session. Yeah. How to join, Aniti? Yes. Let me ask my, the team member to help you. All right. Okay. Okay. And apart from that, guys, do try to prioritize. Okay. Prioritize your stuff. Now you have to be the smart enough that how you are going to the divide your day, and how you are going to take out your time. Okay. Hi Shmaila. So lovely to have you. So lovely to
Shumaila,
have
she was
you.
very active. She used to be very active in that crash course.
Yes, and she is very good, in fact. Yes, 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 very good, very good. Okay, that's great. So it's always lovely to have the own candidates, and to see them, and the way they they regard you, the way they support you, love you. This is such an overwhelming feeling. So thank you so much, everyone. Thank you so much for choosing MedExam. Thank you so much for choosing us. And we really hope, wish, and the pray for your bright future, and we would really be the happy to be part of your success stories as well. Okay. So all the best, everyone. Stay focused, stay motivated, and if any point in time you guys need, any help from our side, you guys are more than welcome. Okay. So I can see Sangamitra is also here. Hello, Sangamitra. I hope you are doing good. Hmm? Okay, that's great. So I can see now. Hi, sweetheart. I miss you. Okay, Soumya is here. Soumya is our part one candidate. And yeah, all of you, Huba, so don't forget to text me. Okay, so inshallah I will call you up. Okay, all right, all right. Okay, guys, see you guys inshallah. Okay, some other time, and we will be doing this talks on the routine, maybe the frequent basis every fortnightly. So be there. Okay, do try to the attend sessions, because this way or that way this is going to help you in your studies. Okay, all right. Thank you so much, guys. Bye bye.